For most of medical history, treating a skin condition meant, looking exclusively at the skin.
Right, exactly.
You put a cream on a rash, you bandage a wound, and you call it a day. But if you are navigating the reality of lichen sclerosus, you already know that the standard playbook is missing this massive, glaring variable.
Yeah, it really is.
The secret to surviving your worst flare-ups might not be in your dermatology cream at all. It might actually be in tracking your menstrual cycle.
Welcome to today's deep dive, everyone.
Because it is it's a compounding biological variable, right? It alters the entire landscape of the condition.
Which is already so difficult to deal with.
Exactly. You're taking an already compromised, highly reactive environment and introducing a monthly seismic shift in hormones, moisture, and friction. Treating the skin without addressing the menstrual cycle is basically like trying to put out a fire while ignoring the gasoline pouring in from the ceiling.
That is exactly what we're unpacking today. We're going to map out the precise intersection between menstruation and lichen sclerosus, or LS. Yeah, we really need to break down the cellular mechanics here. Like why a period changes the behavior of your skin.
And we'll uncover the hidden culprits lurking in your bathroom cabinet. Plus, we're going to lay out some really practical, advanced strategies for surviving your cycle. This is all about giving you back that sense of control.
Right. And gaining that upper hand, it really requires us to look past the surface symptoms. Anyone living with LS is intimately familiar with the intense itching, the burning, all of that.
Oh, absolutely.
But to understand why a period acts as such a profound trigger, we have to look at the structural architecture beneath the surface. We need to examine what's happening on a cellular level.
So let's bypass the basic symptom checklist, right? If you have LS, you don't need us to tell you what it feels like.
No, definitely not.
Let's talk about the baseline environment. What is structurally different about vulval skin that's under an active lichen sclerosus attack?
So what's fascinating here is that the foundational pathology involves this hostile takeover of the skin's extracellular matrix.
Okay, break that down for us.
Sure. In a healthy state, your skin relies on a protein called elastin. It acts like microscopic rubber bands, allowing the tissue to stretch, move around, and bounce back.
Makes sense.
But in an LS flare, the body's immune system mistakenly identifies its own healthy tissue as a threat. And as these immune cells attack, they effectively destroy that elastin.
So those rubber bands are just snapping. They're completely gone.
Yeah, they're gone. And they're being replaced by something much worse. As the elastin is destroyed, the body overproduces a different protein called fibrin.
The fibrin.
Right. Fibrin is essentially biological cement. It thickens and hardens the deep underlying tissue, making it completely rigid. And meanwhile, the topmost layer of the skin, the epidermis, becomes severely thinned out.
So you end up with this structural paradox. So the skin effectively becomes like wet tissue paper, which is incredibly delicate, right?
Exactly like wet tissue paper.
And it's sitting directly on top of a rigid, unyielding bed of cement. It can't stretch. It can't absorb impact. So the slightest friction or environmental change is going to cause a tear or a massive distress signal.
That structural fragility is the baseline. Now, introduce a menstrual period into that environment.
Right.
You are bringing a constant flow of fluid, a shift in pH, and the requirement for physical management products into an area that possesses zero structural resilience.
It's a perfect storm.
It really is. For a significant number of people, menstruation absolutely detonates their lichen sclerosus symptoms. The primary triggers are just the sheer mechanics of it, meaning increased moisture and friction.
Wait, here's where it gets really interesting, though.
The paradox.
Yeah. If excess moisture and mechanical friction are known triggers for fragile skin, how could a period possibly make anyone feel better? Because our sources point out that some people actually report feeling a lessening of their symptoms.
It's wild, right? It seems to violate the basic laws of dermatology. But to understand the paradox, we have to zoom out from the mechanical aspects of menstruation, the blood and the pads, and look at the underlying endocrine system.
The hormones.
Right. We have to look at the massive hormonal shifts driving the cycle itself. Specifically, we have to talk about estrogen.
Estrogen is just the massive elephant in the room when we talk about this condition, isn't it?
Oh, absolutely. It dictates so much of the skin's behavior. Vulvovaginal tissue is packed with estrogen receptors.
Okay.
And when estrogen binds to these receptors, it does several crucial things to fortify the skin. It helps build a thicker, more robust epithelial layer.
Which is exactly what LS destroys.
Exactly. It also increases local blood flow, bringing nutrients to the area, and it provides glycogen, which feeds the healthy bacteria that maintain a protective, acidic pH in the microbiome.
So estrogen is essentially the defensive shield for the specific tissue.
That's a great way to put it.
And we see this reflected in the onset of the disease itself, right? Lichen sclerosus typically spikes in two distinct demographic groups, prepubertal girls and postmenopausal women.
Yep. And the unifying factor between a 7-year-old and a 6-year-old is that their estrogen levels are practically zero.
The shield is down. When estrogen drops, the skin becomes structurally weaker, thinner, and far more susceptible to the autoimmune misfire that characterizes LS.
Wow.
So bring this back to the menstrual cycle. Estrogen levels are not static, they fluctuate wildly. For someone navigating a cycle, the days leading up to and during a period involve a complex hormonal roller coaster.
Meaning that for some people, their individual hormonal surge might actually provide a temporary influx of estrogen to the tissue.
Right.
And that hormonal fortification might be so profound that it temporarily outpaces the mechanical irritation of the bleeding.
Exactly. It creates a highly individualized biological math equation. For the majority, the mechanical irritation of blood and period products is the dominant force. It drives the flare.
Yeah, that makes sense.
But for others, the hormonal shift provides just enough cellular resilience to offer temporary relief. It completely depends on which variable holds more weight in your specific body. Well, let's focus on the mechanical side for a minute, because that's where the majority of the suffering happens. And crucially, it's where we have the most control, right?
Absolutely.
If moisture and friction are the primary mechanical culprits driving a flare during a period, then the tools we use to manage the bleeding must be playing a massive role.
They are active participants in the disease process. The default tools most people reach for are highly destructive in this context.
You mean standard pads?
Yeah, standard sanitary pads and panty liners. They're heavily discouraged. They're engineered to be absorbent. But the way they achieve that is by utilizing synthetic, non-breathable backing materials.
Oh, right.
They completely seal off the area, they trap moisture, increase friction, and contain chemicals that irritate the already vulnerable skin.
Okay, let's unpack this. Using a standard scented pad during an LS flare-up is basically like putting a synthetic, scratchy, chemical-soaked blanket over a sunburn.
That's spot on.
It's a recipe for disaster. You're trapping body heat, menstrual fluid, and sweat against paper-thin, compromised skin.
And that greenhouse effect drastically alters the local pH. It creates a breeding ground for bacterial and fungal imbalances, which just further aggravates the immune system.
And then you add the friction on top of that.
Right. If we connect this to the bigger picture, managing LS is largely about controlling external microtraumas. A rigid synthetic pad rubbing against that thinned-out skin as you walk up. It brings us to a critical clinical concept in dermatology called the Koebner phenomenon.
I want to dig into this Koebner phenomenon. It explains so much the progressive nature of LS. What is actually happening at a cellular level when a pad chafes the skin?
So when the synthetic surface of a pad scratches the fragile vulval skin, those damaged cells panic. They release chemical distress signals called inflammatory cytokines.
Okay.
In a healthy person, the immune system's T cells would receive those signals, rush to the site of the scratch, and, orchestrate a localized healing response.
But in a person with lichen sclerosus, the immune system's programming is corrupted.
Deeply corrupted. The T cells rush to the site of the scratch, drawn by the cytokines, but instead of repairing the micro tear, their autoimmune programming kicks in.
Oh, no.
Yeah, they look at the healthy basal cells around the scratch and attack them. They start destroying the elastin and laying down more of that fibrin cement.
Wow. So the mechanical trauma of the pad doesn't just irritate the existing disease, it actually summons the immune system to create brand new lichen sclerosus lesions in spots that were previously healthy.
Exactly. The pad is essentially an active disease-spreading device.
That is terrifying, but also, incredibly empowering to know. You aren't just managing comfort, you're preventing the physical spread of the disease by eliminating friction. So standard pads are out. What is the strategic alternative?
The entire strategy shifts toward breathability and minimizing tissue contact.
Yeah.
Better alternatives exist, like period underwear.
Oh, I've heard great things about those.
Yeah. High-quality period underwear utilizes capillary action through soft, breathable fabrics, often organic cotton. It pulls moisture away from the body without relying on an abrasive synthetic top sheet. The fabric moves with your body, virtually eliminating the friction aspect.
And for those who prefer an internal method, period discs or menstrual cups are phenomenal options, right? Because they manage the flow at the cervix completely bypassing the external vulval skin altogether.
Exactly. You are keeping the blood away from the compromised tissue. Even if someone insists on tampons, the shift must be toward unbleached, unscented organic cotton.
Right, getting rid of the chemicals.
Yes, you have to remove the bleaching agents and artificial fragrances that act as irritants and trigger that cytokine release.
And this friction-free philosophy has to extend to hygiene as well, doesn't it? The instinct during a period, especially when you feel irritated, is to aggressively clean the area.
Oh, and that's the worst thing you can do. Reaching for scented soaps, shower gels, or even those supposedly harmless intimate cleansing wipes, it's effectively pouring acid on a wound.
Because they strip the skin.
Right. Those products contain surfactants designed to strip away oils. They obliterate the delicate acid mantle of the skin, destroying the protective lipid barrier that LS patients are already desperately lacking.
So what's the pivot?
The mandatory pivot is toward purely mechanical washing with water alone. Avoid soaps and wipes entirely.
The ultimate tool for this, according to the sources, is the Peri bottle.
Yes, absolutely.
It's a simple handheld plastic bottle with an angled nozzle. You fill it with warm water and just use a gentle stream to rinse away the menstrual fluid.
It's brilliant. You achieve cleanliness without a single physical wipe, without a washcloth, and without a drop of chemical soap.
And the drying process is just as crucial, right? You gently pat dry with a soft towel.
Never rub. You can even use a hairdryer on a cool setting to remove the moisture without any physical contact at all. You just have to protect that barrier.
Okay, so changing the hardware, the period underwear, the Peri bottles, that's a great mechanical fix. But we have to address the medical protocol. The gold standard treatment to stop this autoimmune cascade is a highly potent topical corticosteroid ointment.
Right. Usually something like clobetasol alongside daily emollients.
But the anxiety for patients here is immense. You have this incredibly potent medication, and you're supposed to apply it while actively bleeding. The major patient worry is that the menstrual blood will simply wash away or dilute the ointment before it has any chance to work.
Yeah, and because of that fear, many patients just abandon their steroid routine entirely during their period.
Which gives the inflammation free rein precisely when the skin is under the greatest mechanical stress. The medical guidance is clear, though. Carry on with treatment as normal during your cycle.
Yes, you absolutely must.
Well, wait, I have to ask on behalf of the listener. Logistically, this sounds impossible. Is 60 to 90 seconds really enough time for a heavy ointment to penetrate skin that is actively bleeding, or is there a specific way you need to apply it?
It sounds absurd until you look at the pharmacology of the ointment and the physical state of the LS skin. I'll just use an analogy. Imagine a thick, dry sponge.
Okay.
If you pour a drop of oil on it, the oil sits on the surface for a long time before soaking in. That thick sponge is normal, healthy skin with a robust outer layer.
But lichen sclerosus destroys that outer layer. The skin is severely thinned out.
Exactly. The LS epidermis is like a sponge that has been wrung completely dry and sliced paper thin. There's virtually no barrier left.
Oh, I see.
Furthermore, the steroid ointment is designed pharmacologically for rapid transport. The greasy part you feel the vehicle sits on the surface, but the active molecule is highly lipophilic. It loves fat.
Meaning it shoots straight past the surface moisture and binds instantly to the lipid layers of your skin cells.
Right. It bypasses the blood entirely. It dives straight into the cells. And once inside, it literally travels to the nucleus of the cell and turns off the genes, producing those inflammatory cytokines.
That's incredible.
Because the skin barrier is so compromised, that molecular transport happens incredibly fast. If you gently massage a pea-sized amount into the tissue for 60 to 90 seconds, the active drug has already crossed the threshold.
So the blood flowing over the area a few minutes later is only washing away the greasy carrier vehicle, not the medication itself.
Exactly. The medication is locked in at the cellular level.
That completely changes the perspective, but still, the actual act of massaging an ointment into inflamed, bleeding skin for 90 seconds, that can be excruciating.
It can be a sensory nightmare, which is why the protocol involves stacking therapies. You don't just go straight in with the ointment. The most effective hack is utilizing temperature specifically, an ice pack wrapped in a soft, clean towel.
Applying cold before the steroid, why does that work so well?
Vasoconstriction. When you hold a cold pack against the vulval tissue for a few minutes, the local blood vessels shrink and constrict. This temporarily halts the flood of inflammatory mediators rushing to the surface, significantly reducing swelling.
And doesn't it also numb the area?
Yes. The cold physically slows down the conduction velocity of the sensory nerves. The itch and pain signals literally cannot travel to the brain as fast.
That is a brilliant hack. You bring the pain and hypersensitivity way down, dry off with the peri-bottle routine, apply the Clobetal, and massage it in much more comfortably.
Exactly. You transform a torturous ordeal into a manageable clinical routine.
We've covered managing the products and the ointments, but we need to look at the extreme end of the spectrum. What if the period itself is just too heavy and it's completely overwhelming the patient's ability to cope with their LS?
That is the critical threshold. If a heavy menstrual cycle is consistently acting as the primary detonator for severe LS flare-ups, they don't just have to be endured.
Right.
If the localized topical treatments are failing against a heavy period, the next strategic move is to alter the period itself. The clinical advice suggests talking to a doctor about treatments designed to lighten or shorten the menstrual cycle.
So, what does this all mean? Treating the period is actually a valid and strategic way of treating the lichen sclerosus. You aren't just limited to skin creams. You can treat the underlying hormonal trigger itself.
And this raises an important question, right, about how disjointed healthcare can be. A patient with lichen sclerosus is usually managed by a dermatologist,
Right.
but dermatologists do not manage menstrual cycles. Meanwhile, the patient's gynecologist might be fully aware of the heavy periods, but they probably don't grasp the dermatological devastation those periods are causing.
The two specialists are operating in silos.
Exactly. It forces the patient to become the bridge. You have to advocate for a holistic approach to your body. Suppressing that bleeding through contraceptive pills and IUD, whatever it might be, becomes a vital dermatological strategy.
You're shutting off the gasoline supply to the fire.
You're dictating the terms of your body's environment.
Well, let's recap this deep dive. Menstruation can definitely worsen LS due to moisture, friction, and hormones. But by ditching the pads, embracing peri-bottles, religiously massaging in your steroid cream for 90 seconds after using an ice pack, and potentially medically lightening your cycle, you can take back control of your month.
And I want to leave everyone with a final thought to mull over, drawing on something we discussed earlier about estrogen.
Oh, right, the estrogen drop.
Yeah. The sources note that LS often improves naturally around puberty, but peaks again during perimenopause due to those estrogen drops.
Yeah.
If LS is this profoundly tied to the life cycle of our hormones, could tracking your daily symptom severity alongside your basal body temperature and exact menstrual cycle phases allow you to mathematically predict your personal flare forecast?
Wait, really? Like predicting it before it even happens?
Think about it. If you know your tissue vulnerability peaks right before your period when estrogen crashes, you could preemptively increase your emollient application. You could pre-medicate and fortify the barrier before the hormonal storm hits.
You aren't just reacting to the fire, you are fireproofing the house. That is incredibly empowering. Thank you for joining us on this deep dive, everyone. Stay curious, keep fiercely advocating for your health, and we will catch you next time.